Ready when you are.
Okay.
Hi, I'm Dr. Mark Garner. We're going to be discussing scoliosis. Scoliosis is a neurologic condition which causes aberration to the spine. So we have a brain, we have a body, a tailbone, shoulders. We have a brain from the side, a neck, a mid-back, a low back, and a tailbone. So scoliosis is modification of these curvatures, producing an aberrated or abnormal curve. This is mediated in the brain stem by the inferior olive. So here we have a brain stem, we have a cerebellum, and we have a cortex. The inferior olive right here is the mediator to modify the muscle tone of the rotary and multifidi muscles of the spine, producing an abnormal focal curvature, which we call scoliosis. So we can call scoliosis as evidenced by a curved spine, and then scoliosis as considered a disease process, which is an aberration of the inferior olive. So the inferior olive is going to take its map from the parietal lobe somatosensory strip. The parietal lobe has a map that identifies every part and parcel to the body and where those body parts should be. And when the map gets disrupted, sometimes we develop a scoliosis that's abnormal, and the map is telling the inferior olive via the cerebellum, we need to modify the multifidi and rotary muscles here, producing an abnormal curvature. So when a scoliosis or an abnormal curvature is identified in a child, say for instance a female 7 to 10 years old, it's generally x-rayed to determine a Cobb angle, and the Cobb angle indicates severity and provides a mechanism for mapping the scoliosis over time. An allopathic or surgical remediation for this would be surgical intervention with installation of Harrington rods, titanium rods that go parallel to the spine to induce a straighter spine. However, neurologically what's occurring is the parietal lobe has an aberrated map. It's instructing the inferior olive to produce that as a pro-survival effort, which is aberrated. It's not correct, but the brain is trying to produce this survival endeavor. It thinks that that curve is pro-survival, so it induces these small muscles to produce the curve. So prior to delving into surgical interventions, there are functional neurology mechanisms using the eyes. This is called optical kinetics. Optical kinetics produce a twitching, specified twitching of the eye, which passes through the frontal accessory eye field. The frontal accessory eye field modifies and stimulates the parietal map to change from aberrated to symmetrical, and the signal to the inferior olive is modified to this curve and reduces the curve. So over the growth period, we now have a curve that's 4 degrees instead of 16. We modified it through the growth period in the child by stimulating the parietal map of the brain, which signals the inferior olive to instruct the muscles to do something differently. This is identified on functional neurology examination and utilizing optical kinetics to stimulate the brain correctly, to give it a better signature and signal to the muscles which are following out the commands of the parietal cortex. So this is a functional neurology intervention developed by Frederick Carrick at the Carrick Institute for Graduate Studies. I'm Mark Garner, board certified chiropractic neurologist, and best wishes to you and your family.